Good day, ma'am. I am Belinda Torian from Section Alpha, and I am going to discuss the artificial and natural methods of contraceptions. So let's start with the artificial methods. First, oral contraceptives. Oral contraceptives is the birth control pill. It is a type of contraceptions that contains hormones that prevent pregnancy. People call it the pill because it comes in pill form. Women take the pill orally by mouth once a day. The pill is most effective when you take it consistently at the same time each day. Advantage: it allows them to put off having children until their bodies are fully able to support a pregnancy. It can also prevent pregnancy for older people who faced pregnancy-related risk. Contraceptive use reduces the need for abortion by preventing unwanted pregnancies. Disadvantage: it can increase your blood pressure. It does not protect you against sexually transmitted infections. Breakthrough, bleeding, and spotting is common in the first few months of using the pill. It has been linked to an increased risk of some serious health conditions, such as blood clots and breast cancer. Side effects: the most common side effects are spotting or bleeding between periods. This is more common with progestin-only pills, sore breast, nausea, or headaches, but these usually go away after 2 or 3 months and they don't happen to everyone who takes the pill. Birth control shouldn't make you feel sick or uncomfortable. Second is a transdermal patch. A transdermal patch acts as a carrier for a drug, holding it until it's applied. At the point of application, the patch adhesive secures it to the skin, and the drugs contains it in the patch will begin to permeate into the bloodstream. Advantage: transdermal patches deliver drugs directly into the circulatory system, bypassing the gastrointestinal system and avoiding the hepatic first pass effect. This delivery system is advantageous for the treatment of depression with monoamine oxide inhibitors or MAOIs. Disadvantage: the patch is not a perfect means of contraceptions because some drawbacks listed below. It does not provide protections against sexually transmitted infections or STIs, including HIV, must be prescribed by a healthcare provider. The estrogen levels are higher with a patch than with other hormonal methods. Side effects or risk: headache, breast pain or tenderness, nausea, vomiting, constipation, gas, heartburn, weight gain or weight loss. Third is the vaginal ring. Vaginal rings are polymeric drug delivery devices designed to provide controlled release of drugs for intravaginal administrations over extended periods of time. The ring is inserted into the vagina and provides contraceptions protection. Vaginal rings comes in one size that fits most women. Advantage of vaginal ring: the ring may ease premenstrual symptoms and bleeding will probably be lighter and less painful. Disadvantage: you may not feel comfortable inserting or removing it from your vagina. Side effects or risk: some women have temporarily side effects, including more vaginal discharge, breast tenderness, and headaches. Fourth is the subdermal implants. Subdermal contraceptive implants involves the delivery of a steroid progestin from a polymer capsules or rod placed under the skin. The hormones diffuses out slowly at a stable rate, providing contraceptive effectiveness for 1 to 5 years. The period of protection depends upon the specific progestin and the type of polymer. Advantages of progestin implants includes long-term contraceptive actions without requiring the user's or provider's attention. Low dose of highly effective contraceptions without the use of estrogen and fertility is readily reversible after the removal of implants. Disadvantage: you may experience temporary side effects during the first few months, like headaches, nausea, breast tenderness, and mood swing. Your periods may be irregular or stop altogether. You may get acne or your acne might get worse. Side effects or rest: nausea, stomach cramping or both bloating, dizziness, headache, breast tenderness, acne, hair loss, weight gain, and vaginal irritation or discharge may occur. Pain, bruising, numbness, infections, and scarring may occur at the site where the rod is placed. 6 is the intrauterine device. An intrauterine device or IUD is a small contraceptive device that is put into the uterus to prevent pregnancy. The two types of available in Australia are the copper IUD and the hormonal IUD. The copper IUD is designed to stay in the place for up to 10 years and the hormonal IUD for 5 years. Advantage: it can prevent pregnancy for older people who face pregnancy-related risk. Contraceptive uses reduces the need of abortion by preventing unwanted pregnancies. It therefore reduces cases of unsafe abortions, one of the leading causes of maternal death worldwide. Disadvantage: there are certain disadvantages of the intrauterine devices. These IUDs are expelled without the knowledge of the wearer is about 10 to 15% of the women, and they run the risk of becoming pregnant. There is a risk of perforation of uterus and infections. They can cause excess menstrual bleeding and pain. Side effects or risk: spotting between periods, irregular periods, heavier or longer periods, more or worse cramping during the periods, pain when your ID is put in, and cramping or back aches for a few days after. 7 is the chemical barriers. Chemical barriers or spermicides are sperm-killing substances available as foams, creams, gels, films, or suppositories, which are often used in female contraceptions in conjunction with mechanical barriers and other devices. Spermicides are usually available without prescriptions or medical examination. Advantage: easily available and affordable condoms can prevent the spread of STDs when used proper. Disadvantage: these methods do not prevent pregnancy, as well as IUDs or hormonal forms of birth control. Barrier methods prevent pregnancy only if you use them every time you have sex. You may have to interrupt sex to use some barriers methods of birth control. Side effects or risk: the spermicide used with the diaphragm can increase the risk of getting HIV from an effective partner. Use of the diaphragm and spermicides may cause vaginal burning and irritations from the spermicide. Use of the diaphragm and the spermicide may increase the risk of urinary tract infections or UTI. 9 is the cervical cap. The cervical cap keeps sperm from entering the uterus by covering the cervix. For added protection, spermicide is put into the cap before inserting the cap snugly over the cervix. The cap can be put in several hours before having sex and must be left in at least 6 hours after sex. Advantage: the cervical cap protects against pregnancy for 2 days, 48 hours, and for multiple acts of intercourse within that time frame. Disadvantage: the cervical caps does not protect against STI. You should not use the cervical cap when you have any kind of cervical bleeding. It could increase your risk of toxic shock syndrome or TSS. Side effects or risk: side effects may include from the spermicide irritations of the vagina and surrounding skins of an allergic reactions, strong odors, or vaginal discharge if the cup is left in too long, an allergic reaction to the material in the cup, changes in the cervix because of the irritations. 11 is the female condom. Female condoms are a barriers method of contraceptions worn inside the vagina. They prevent pregnancy by stopping sperm meeting an egg. A female condom can be put into the vagina before sex, but make sure the penis does not come into contact with the vagina before the condom has been put in. Advantage: female condoms helps to protect both partners from STI, including HIV. When used correctly, they are a reliable method of preventing pregnancy. It is a form of contraceptions you only need to use when you have sex. There are no serious side effects. Disadvantage: some couples find that putting in a condom interrupts sex. To get around this, insert it in advance or try to make doing so a part of foreplay. 12 is a surgical methods. A surgical methods is a medical procedures involving an incisions with instruments performed to repair damage or arrest disease in a living body. Synonyms: operation, surgery, surgical operation, surgical process. Advantage: prevention of or improvements to medical conditions caused by a patient's obesity. Surge in energy, increased life expectancy, increased self-esteem, weight loss, better sleep. Disadvantage: some of the disadvantages of surgical sterilizations includes the following. It requires surgery, usually under the general anesthetic. There is a risk, albeit low, of surgical complications such as internal. Side effects: arrest. Side effects can include weight gain, headaches, mood swings, breast tenderness, and irregular bleeding. So let us now proceed to the natural methods. First is the abstinence. Abstinence is simply not having sexual intercourse. If you're abstinent, it means you've decided not to have sex. This includes vaginal, oral, and anal sex. Abstinence prevents pregnancy by not giving the opportunity for semen to enter the vagina. A sperm can't fertilize an egg if you don't have intercourse. Advantage: abstinence can be a way to avoid the risks that come with sex, like pregnancy and STD, until you're all ready to prevent and or handle them. Abstinence can also help you focus on other things in your life that are important to you, like friends, school, sports, activities, having fun, and planning for your future. Disadvantages of abstinence experience shows that even people committed to abstinence may unexpectedly have sex and may not be prepared to protect themselves from pregnancy and STIs. Many people find it difficult to maintain abstinence over the long term. Side effects or rest. There are no side effects. Second is the calendar method. It is a form of natural family planning. To use the rhythm method, you track your menstrual history to predict when you ovulate. This helps you determine when you are most likely to conceive. Advantage: by calculating the midpoint of the cycle, women can also work out when they are potentially fertile and when they are definitely infertile. Disadvantage: the biggest drawback is that it's not as effective in preventing pregnancy as other birth control methods. It requires you to be diligent in tracking and recording your cycle. Side effects or rest. The rhythm method is an inexpensive and safe way to help you chart your fertility. Third is the basal body temperature. Your basal body temperature is your temperature when you're fully at rest. Ovulation may cause a slight increase in basal body temperature. You'll be most fertile during the 2 to 3 days before your temperature rises. By tracking your basal body temperature each day, you may be able to predict when you'll ovulate. Advantage: basal body temperature can be used as a way to predict fertility or as a part of a method of contraceptions by helping you gauge the best day to have or avoid unprotected sex. tracking your basal body temperature for either fertility or contraceptions is inexpensive and doesn't have any side effects. Disadvantage: it offers no protections from sexually transmitted diseases. Sometimes this method is not effective in preventing pregnancy due to the outside factors that can affect basal body temperature. Side effects or risk: the basal body temperature method has no side effects. The only cost is the price of the thermometer. Fourth is the cervical mucus method. The cervical mucus method is a type of natural family planning, also called the billing ovulations method. The cervical mucus method is based on careful observations of mucus patterns during the menstrual cycle. Advantage: the cervical mucus method is good for determining when you're fertile by using your vaginal discharge as a way to determine when you are in your cycle. Disadvantage: one disadvantage is that this method is not always easy to learn without the guidance of your OB/GYN or doctor. Side effects or risk: using the cervical mucus method to promote fertility doesn't pose any risk. Likewise, using the cervical mucus method for birth control doesn't pose any direct risk, but it doesn't offer protection from sexually transmitted infections. And lastly, coitus interruptus. Coitus interruptus, also known as withdrawal, is a traditional family planning method in which the man completely removes his penis from the vagina and away from the internal genitalia of the female partners before he ejaculates. Advantage: some benefits of coitus interruptus are that the method, if used correctly, does not affect breastfeeding and is always available for primary use or use as a backup method. In addition, coitus interruptus involves no economic cost or use of chemicals and has no directly associated health risk. Disadvantage: first, men discharge a small amount of semen before ejaculation. Second, men withdraw their penis late and inseminate the female. And 3, side effects include loss of sexual. Side effects or risk: using the withdrawal method to prevent pregnancy doesn't pose any direct risk, but it doesn't offer protection from sexually transmitted infections. Some couples also feel that the withdrawal method disrupts sexual pressure. And that would be all. Thank you.